Okay, let's take a look at objective 7, diseases and disorders of the urinary system. So the first one we're going to talk about is glomerulonephritis. This is an inflammatory disorder, inflammation, itis, okay, of the filtration membrane, the glomerulus. That's where that comes from. Within the renal corpuscle. So remember, the renal corpuscle has got Bowman's capsule, and within that is the glomerulus. So we're talking about inflammation at the capillary, the glomerulus, which increases the filtration's permeability. So plasma proteins, blood may enter the filtrate, which increases urine volume due to increased osmotic concentration of the filtrate. So what happens is when the inflammation occurs, it's actually going to allow more particles, larger particles, to pass through into the filtrate. So that's what they're talking about, increased osmotic concentration. We're talking about dissolved solids there. So if it occurs on its own, it's called primary glomerulonephritis. If it occurs due to another disease, such as, underlying disease like lupus or diabetes, and that's where it comes from, they can trace it back to that, then it's secondary. And that's true for anything. So primary means that's kind of on its own. Secondary, it's a step off of another disorder, okay? So acute glomerulonephritis, this is one, remember what we said about the difference between the words acute and chronic. Acute is going to be something that's going to be short-lived, where chronic is going to be something that takes a long time. It's going to be lasting for a while. So this occurs after maybe a bacterial infection, even something as bad as strep throat. You think, well, that's in the throat, this is in the kidneys. Believe it or not, yes. So 1 to 3 weeks after maybe a strep throat infection, acute glomerulonephritis could present itself. It'll go away in a couple of days. Your body's going to produce extra antibodies that's going to settle in the glomerulus, causing inflammation. So in response to your initial bacterial infection, your body's going to do what it normally does with a bacterial infection. It's going to generate antibodies, where they're going to kind of get clogged up there in the glomerulus of the kidney, causing inflammation to occur. So you've got your swollen kidney here on the left, and then the normal kidney there on the right. Chronic glomerulonephritis, again, long-term progressive, meaning it's going to get worse over time. The filtration membrane thickens and is eventually replaced by connective tissue. Anytime you've got scar tissue replacing, that tends to be an issue of concern. The kidneys actually become non-functional. So this right here, what you're looking at in this image, is chronic glomerulonephritis. This is at the end stage. This is the final, this isn't the onset of chronic glomerulonephritis. This is at the end of that. So underlying diseases, again, it could be genetic, could be a genetic issue, could be diabetes, could be lupus. So these things are underlying conditions for that. So this would be secondary chronic glomerulonephritis. Okay. Pileonephritis begins as E. coli bacterial infection of the renal pelvis, which spreads to the rest of the kidney. So we're talking about like an urinary tract infection is what we're talking about here. So a urinary tract infection that has moved into the pelvis area of the kidney. So it's gone from the bladder up the ureters and is now settling in the kidney. This infection can destroy the nephrons, the corpuscles, loops of Henle. So it's basically causing destruction within the entire kidney and the whole nephron. So it results when a urinary tract infection moves all the way up into the upper urinary system. That's the kidneys and the ureters. So this is a complication of a typical bladder infection. So if y'all say, oh, I've got a bladder infection, I'm fine, I'm just go to the doctor and get some antibiotics so it doesn't progress to this level, okay? Renal failure occurs when the damage to the kidney is rapid and extensive. So this is acute renal failure, okay, versus chronic renal failure. So this happens very quickly. This can lead to accumulation of waste in blood. So obviously, if the kidney's not working, you're going to develop a lot of stuff in the blood. If renal failure is complete, death can occur in 1 to 2 weeks unless dialysis, unless somebody gets dialysis. So, um, acute renal failure. This could be something as even um, like a physical hit to the kidney area could cause something like this to occur. Okay, that's it for the diseases.